you doing today? This is Dr. Adeshina from ftplectures.com. I'll be talking to you about applying to medical school in the United States. So, you're an applicant, and you've completed all your prerequisites for medical school. You've taken your physics, your chemistry, your biology. You've taken your organic chemistry. You've taken all these pre-medical classes, and it's time to apply to medical school. Just like you, I was in your shoe a few years ago, and I had to make this decision. And a lot of students every year get confused. Where should I apply to? I'm hearing all these different schools I can apply to. Where do I begin? Well, today I'm going to shed some light on how to make some decisions and how to approach applying to different medical schools and actually understand the different kind of medical schools and different career options that's actually out there for students interested in going to medicine. So, when I was applying to medical school, I was like, I just want to be a doctor. I want to be an excellent doctor. I want to be able to take good care of my patients. And that was my goal. And then I ran into something new that I've never heard before. That there's actually 3 ways you can become a doctor in the United States. The first one is you can go to an MD school. This is a school where they offer degrees in Doctor of Medicine. And then there's another option. So you can go to a DO school, which is Doctor of Osteopathic Medicine. And also, you can also come from an IMG, International Medical Graduate, by going to the Caribbean, where they also give MD degrees similar to the Doctor of Medicine. So these are all your options when you are applying to medical school in the United States. Well, as an applicant, a pre-med applicant that has no idea what's really going on in the field of medicine, it gets very difficult to know which pathway should I take. Most students know about Doctor of Medicine. Some or most people also have heard about Doctor of Osteopathic Medicine. And also, a lot of people have probably heard about schools in the Caribbean, which is another option. So what I'm going to do today is talk about what are the differences and the similarities between all these degrees, and also how applicants are gauged and how these schools' philosophy differs, and which is what makes them give out different degree options. So let's start with the first one. MD schools. In the United States, we have about 126 MD medical schools in the US. And we have about 29 schools in the United States that give out the degree Doctor of Osteopathic Medicine. And we have a lot of schools also in the Caribbean that will give out that give out MD degrees in the Caribbean islands. There's different ones, which I am not 100% familiar with, but I do know a couple of them. There's Ross School of Medicine, there's St. George's, there's one in Antigua, and the list goes on and on and on. The most important part is these schools just have to be accredited by a United States institution and recognized in the US. That's the most important thing. So now that we know how many schools we can actually apply to, let's look at the similarities between getting an MD degree and a DO degree. MD students go to a 4-year rigorous, extremely rigorous, just as DO students also go through extremely rigorous medical education. So these are going to be similarities. Four years of medical school. So we're going to link this together. Also, the same goes for IMGs. They go through 4 years of rigorous medical education. Also, another similarity between a doctor that has an MD degree and a DO degree is that these both students that go through these medical schools also can specialize in any specialty. What are the specialties we have in medicine? We have a lot of specialty in medicine. So if you graduate from a medical school and you get an MD degree and a DO degree, you can decide to practice in any specialty you want to. What are the specialties we have? Let's start with primary care. Primary care, and for those who doesn't know what primary care is in the United States, primary care is actually the front line of medicine. These are the doctors that specialize in disease prevention. When we talk about disease prevention in medicine, we talk about chronic medical illnesses that patients have over a long period of time. Let me simplify that for you. So you have an older person which is in their 40s or their 50s, and they have high blood pressure, which we refer to as hypertension. Or they have diabetes. You probably heard of diabetes, right? It's a lifelong illness, right? So patients that have hypertension or diabetes, or they have cholesterol problem, which we refer to as hypercholesterolemia in medicine, you have to manage these patients for the rest of their life, from the day you diagnose the disease to the day they pass away. So that's, if somebody lives up to 100 years old and you meet them when they're 20, 30 years old or 40 years old, you'll be treating them for 60 years. So these patients are going to be seeing primary care doctors. And these primary care doctors are family medicine, pediatrics medicine, and also internal medicine. These are known as the primary care specialties. The primary care specialties. So, a patient that has diabetes will be managed by his family care doctor forever. And also pediatrics, right? When a child is born, has to go to see the pediatrician. These are the doctors that specialize in taking care of babies. So they take care of babies from the time they're like 1 month old up until the time they're 18 years old. So when you're up to 18, your pediatrician is going to be the one taking care of you. Internal medicine doctors can take care of patients older than 18 years old and also adults. So there's an overlap between internal medicine doctors and family medicine doctors. Internal medicine doctors tend to have their own private practice, and also they can also work in the hospital, known as hospitalists. They stay in the hospital for 7 days, and they can work there for extended amount of time, taking care of patients inside the hospital, and they can also have their own group practice. And their population can start from either 18 years old up until 90 years old. This is known as internal medicine. So that's the primary care specialty. So if you're an MD or a DO, you can go into any of the specialties. Also, now we have specialists. If you now want to specialize in medicine, I'm going to combine specialists and also the other rest of the medical careers that you can choose. You can become an emergency medicine physician. You can become a psychiatrist. Somebody that takes care of patients that have mentally challenged problems like depressions or anxiety, psychosis. You can become a specialist in medicine and become, if you're an internal medicine doctor, you can specialize. You can decide to specialize, and this specialist in internal medicine, you can say, I just want to specialize in the heart. And you become a cardiologist. You have to do a fellowship for 3 years. After doing a 3 years internal medicine residency, you can decide, say, I want to specialize in the lungs. You pick an organ system and become a pulmonary or even critical care. They work in the ICU doctor. You can say, I just want to specialize in the bowel, right, in the intestine. So you become a gastroenterologist, GI doctor. You could say, wait a minute, I just want to specialize in the brain. So you become a neurologist. But neurologist is actually a different aspect because you don't have to go through internal medicine to become a neurologist. So we're going to put neurology here. So you become a neurologist and you just specialize in the brain. But neurologist is not the same as a neurosurgeon. Okay? Let's say you want to become a surgeon now. Surgeon, right? You can be a neurosurgeon and specialize in operating on the brain. That's known as neurosurgery. And you can be a general surgeon, or you can be a bariatric surgeon, and you can pick what aspect of surgery you want to specialize in. You want to do breast and mammary surgeon, and those are different specialties under surgery. So aside from this, you can also become an endocrinologist. You just specialize in the thyroid, adrenal problems, diabetes. You manage a lot of thyroid, a lot of endocrine problems in the body. That's an endocrinologist. But remember, you have to go through 3 years of internal medicine before you can become any of this. You can decide to be an infectious disease doctor. You just specialize in microorganisms and how the antibiotics work to kill all these bugs. So these are all the different kind of specialties under internal medicine. You can also decide to become a sports medicine doctor. Sports medicine. And there's 3 ways to become a sports medicine doctor. You go through family medicine, 3 years of family medicine residency, or you go and then you specialize in sports medicine. You can become an emergency medicine doctor and specialize in sports medicine. So you do 3 years or 4 years of emergency medicine, and then you go into sports medicine. And also, you can go through PM&R, which is known as a physiatrist, physical medicine and rehabilitation. So PM&R. Now, if you want to know what PM&R doctors do, they're the guys that specialize in recovery. So a patient has a stroke and they have to recover back. The PM&R doctors are the ones that specialize in getting your muscles and your bones to get moving again. So you go through a lot of rehabilitation. They do a lot more work in that. I'm just giving you an example in this case. Also, you can also decide to work on the eyes and become an ophthalmologist. And just be an ophthalmologist. This is different from optometrists. Optometrists get OD degrees, which is different from DOs, because sometimes people mix that with each other. Optometrists go to optometry school. Doctors of osteopathic medicine go to osteopathic medical school. So ophthalmologist, and it's a surgical specialty. And you can see all the different aspects of medicine you can go into. So you can go also into preventative medicine, which is another aspect of medicine that works with public health related issues with women, general disease prevention and control. That is known as preventative medicine. So as you can see, we've got all these different specialties, and the good news is if you end up going to a MD school or a DO school, you can go to any and become any. And just I almost missed one. You become an obstetrics and gynecologist. These are the doctors that deliver babies. They do surgeries, they do hysterectomies, they take out the uterus if a patient needs to. These are the patients that also follow women to make sure they have their pap smears done, their mammograms done. These are obstetrics and gynecologists. And we also have anesthesiologists, doctors that put you to sleep before surgery. And we have radiologists, are the doctors that read x-rays, CT scans, MRI machines, radiographs, and and also ultrasound. These are all the different kind of doctors that you can be if you end up in 1, 2, or 3. You can end up in any of these specialties as long as you're in the United States and you practice medicine. So we've got a lot of options, right? I've broken down every single specialty you can actually possibly go into, and hopefully I'm actually not missing any of them. Okay, you can also become a urologist. A urologist is a patient that specializes in just prostate and also renal problems. If you go through internal medicine, you can become a nephrologist. And nephro means kidneys. They just specialize on how the kidney works, and they're just a specialist just for the kidneys. Now, just to quickly hint, how many years does it really take to get through all the specialties? Family medicine, 3 years. 3 years is how long it takes to finish family medicine. Pediatrics, 3 years. Internal medicine, 3 years. If you want to specialize, cardiology is 3 years of a fellowship. Pulmonary critical care is actually 2 to 3 years also. GI is 3 years. Endocrine is around 2. Infectious disease is around 2 to 3. Nephrology is also around 2 to 3 years, depending. I'm not specifically, I don't know specifics as to nephrology, but I know it's probably a 2 to 3 year fellowship. Emergency medicine, you can go to either a 3 or 4 year residency. Psychiatry is a 4 year residency. Neurology is a 4 year residency. Surgery is a 5 years, but then you want to specialize in a fellowship, it depending. You can spend another 2 to 3 years, depending on what kind of surgeon you want to be. Neurosurgery is 7 years. Sports medicine, 4 years. Right? Or either you actually do 3 years of family, and you can do either a year or 2 of sports medicine fellowship. PM&R is 4 years. Ophthalmologist is a 5 year specialty. Preventative is combined with family medicine to get a 5 year residency. Obstetrics and gynecologist is 4 years. Anesthesiologist is 4 years. Radiologist is 5 years. Urologist is a 5 year residency. So on average, you see, it takes about 3 to 7 years to complete residency, right? So if you're an MD from the United States or an MD from International Medical School or DO, the similarities means we all complete between 3 to 7 years after 4 years of medical school. Those are the similarities between MDs and DOs. Now, let's talk about what makes this doctors different, right? You know, you go to an MD school, you go to a DO school. What is actually the difference, right? We know the similarities, they both go through 4 years. And also, before we progress, we've got to talk about the MCAT, right? Let's talk about how you get into these schools before we actually proceed. So in order to get into any of these medical schools, they all require that you take the MCAT, and you have to have a GPA. You have to have a GPA and MCAT to get into these medical schools. Now, I'm going to be very honest with you. Over the last 5 to 10 years, especially in the last 5 years, the amount of applicants that apply to medical school has skyrocketed. Like the amount of students that are interested in becoming doctors have actually exceeded their normal applicant pool. So as the applicant that's watching this video right now, you have to be very realistic to know that you have to be very competitive to get into these medical schools. Now, this used to be the central dogma back in the days, and usually students talk about this, and it's very important that I clarify this. The old central dogma, which is not true anymore, is that if you don't do well on your MCAT, and you can't get into an MD medical school in the United States, you are going to be able to get into a DO schools because they take people that don't do well on the MCAT. That is not true anymore. That used to be what people used to say. But over the last 5 to 10 years, this has changed completely. It is as competitive to get into an MD school in the United States, and it's the same to get into a DO school because it's extremely, extremely competitive. Let me give you some numbers. An MD school can get about 5,000 applicants, and a DO school can get up to 4,000 applicants, and you still have to go through the rigorous process to be able to get into these schools. It is not an easy process, so don't let anybody lie to you. Also, people do say that if you don't do well on the MCAT, you can get into IMG's medical school, which is International Medical Graduate Schools, which are also schools in the Caribbean islands. That it still holds true. So people or applicants that is applying to medical school in the United States that can't get into an MD or a DO school, you can't give up hope. And I don't want you to feel inferior because you're going to be an excellent doctor even when you go to a Caribbean medical school. But we are still going to talk about the advantages and the disadvantages of going to an international medical school. But you still have to understand, if that's your dream and your goal, don't give up. Because don't let these numbers that I'm going to talk about in the next few minutes discourage you from being a doctor, because people that go to international medical school do excellent. They're excellent physicians, just like people that train in the United States. So Let's look at some average numbers of MCAT scores that patients actually, students, I mean to say, use to get into MD schools compared to DO schools. Let's look at GPAs. The average GPA for students going to applying to DO schools is often around 3.4 to 3.5. 3.4 to 3.5. Now remember, that's the word average, right? So let me explain what average means. This is the bell curve for applicants, right? And we have a standard deviation of -2 and +2, right? And the average is in the middle, okay? So when I said the average score that the average GPA for students that are applying to DO schools between 3.4 to 3.5, in an MD schools, it's a little bit, but also around 3.5. So it's pretty much almost the same. Can you see that? Good. Let's take a look at the MCAT scores. The average MCAT score today, right? It's 2012. Today, for students applying to MD schools, is around 29. That's the average MCAT score. For DOs, the average MCAT score for DO schools is around 25 to 29. Now you might say that, oh well, so if I get a 25, I still have a chance of getting to a DO school. Yes, that's still possible. But you can see that as the applicant pool is getting more and more competitive, you do not want to score a 25 and think you're going to get into a DO school. It's like shooting yourself in the foot. Because by the time you look at the applicant pool, majority of the people applying to DO schools have scores around 28, 29, and 30s. So, but at the same time, don't ever get discouraged if you have a lower MCAT score, because take a look at the graph. I said the average MCAT score is a 29, right? Average means the middle. If I take a sample of all the applicants that apply to medical school today, and I divide them by the number of applicants. So if you have 1,000 applicants, and I divide it by the number, and I have 1,000 applicants, which would be N, and I take all the average MCAT scores and I add them all together. So I divide the sum, right? The sum of all their scores, MCAT scores, divided by the number of applicants is around 29, right? Which means that's the average. That means somebody got a 24, a 23, got into medical school, and somebody that had a score higher than 29 that scored a 30, 32, 45, 44, all got into medical school. This is what average scores mean. So as an applicant, don't ever be discouraged by the numbers, because they are very tricky. Now, medical school application is very, very intense, especially when the admissions committee is taking a look at your application. So this is very important that you listen. They always look at your MCAT score and your GPA, and I always advocate to students, make sure you get a higher MCAT score and a higher GPA. The higher the number, the better. But don't ever get discouraged. That's why I made how to get into medical school part 2 video, which you should watch. You know, you can click here if you want to go back and watch the video to notice that this scores doesn't mean you're not going to be a doctor. If you get a lower score than these numbers, that is not a disadvantage, because you've got options. You got 2 options. Retake the MCAT or apply to international medical schools. When you apply to these schools, they have a different philosophy. The philosophy is, we are going to make you a great physician as long as you have the passion and the drive. So we're not going to let numbers determine your goals to become a doctor in life. That is a good thing, because now you can capitalize on that. Because let's say you're just a great test taker, right? And that's, you know, people do have that problems. You know, they're not great test takers, and they've been taking MCAT the first, the second, the third, the fourth time, and they're just sick and tired of taking the test. They've got an option to go to these schools, which take a lower MCAT score, and they can even take a lower GPA, as long as you're willing to work very hard when you get to the medical school and study very well. That is the most important thing, all right? So those are the average scores that MD applicants and DO applicants usually get into medical school. But remember, there's other things they look at. You look at your letter of recommendations, they look at your personal statement, they look at your involvement in the community, they look at your passion and your drive. You still have to go through the interviews. So this is only 2 pieces out of the application process. That is a very important thing you have to know. Now, let's talk about what is exactly the difference between an MD and a DO medical school. So I attended the University of Medicine and Dentistry School of Osteopathic Medicine. I'm a DO and I'm an emergency medicine resident at St. Luke's Hospital. Now, I'm going to show you the path of what led me into osteopathic medicine. I already told you the similarity between an MD and a DO, and I'm going to share with you today what the differences are going to be. The difference between an MD and a DO is basically a philosophy. It's a state of thinking. So let's take a look at an MD school. When you go to a medical school in the United States that give out MD degrees, they focus, right? The philosophy is research. Philosophy. It's a research, scientific research based driven medical school, which means they focus a lot on making sure how do we get the latest discoveries in medicine. For example, how we find the next cure for Alzheimer's, the next cure for disease processes. So, but the doctors that do these are often PhD doctors and also MD doctors. So you can actually become a PhD, MD PhD, which is even offered in MD schools. You can get both degrees, right? It's like a double doctor, but it's a lot of emphasis on research, right? Publications, research, publications in medicine. And also treatment of disease pathologies and treatment. This is the focus of MD's philosophies. Now let's take a look at osteopathic medical schools. They have a different philosophies, and DOs actually started in 1874. Which was discovered by a doctor known as A.T. Steele, Dr. A.T. Steele. Now, Dr. A.T. Steele thought there's a different way we should approach medicine. Like I said, it's a different philosophy. And his idea is basically states that the mind, the body, and the soul, they're all connected. And if there's a dysfunction in the musculoskeletal system of the patient body, you should be able to use your hands to be able to fix this dysfunction. That was the theory, and that was the belief that Dr. A.T. Steele came up with, and that's why they call it osteopathic medicine. Now, just like I was confused when I was applying to medical school, when I heard the word osteo and pathic, I thought these were doctors that treated bones, right? It might sound confusing, right? You might think bones, pathology of bones, medicine. But that's not the true definition of osteopathic medicine. Osteopathic medical school focuses on primary care. Remember at the beginning, I was telling you about the 3 primary care specialties: family medicine, internal medicine, and pediatrics. So if you decide to apply to an osteopathic medical school, the difference is they're going to teach you how to use osteopathic manipulative medicine, OMT, or OMM, osteopathic manipulation techniques. And these are actually techniques. For example, let's say a patient has lower back pain. They're going to train you on how to diagnose where there's a tender point. So you touch the patient's back like, oh, that hurts. And you said, oh, you know, what were you doing? Well, doc, I was twisting this way, and I twisted this way, and I kind of turned, and I couldn't move back again, and it hurts now. Well, there's two options to treating you. As an osteopathic doctor, I can just give you Motrin or ibuprofen, and that will take away the pain. But it's a mechanical problem. So in osteopathic medical schools, they teach you how to use your hands to diagnose where the problem is. They call it somatic dysfunction because your body's twisted in the wrong direction, and then teach you techniques of how to fix it back. So you put the patients back into their initial position, and this will help them heal better. But the good news is, as an osteopathic medical physician, you're licensed just the same way as an MD to be able to prescribe medications and perform surgeries. So if you're a surgeon, you will be able to actually, you can use your hands to treat the patient. If they need surgery, you said, oh, you're going to need surgery. We're going to have to take you to the operating table and actually probably do a discectomy or something like that, or laminectomy, whatever procedure the surgeon thinks is that it's needed. So the biggest difference when you decide to apply to a DO school is to know that you're going to learn how to use osteopathic manipulative medicine. And this involves treating the muscles, which is the musculoskeletal, the skeletal system, which involves also the bone system, ligaments, soft tissues, your fascia, and they teach you on how to treat a patient from head to toe. Every single part of the body can be manipulated in one shape, form, or the other to be able to fix any problem. And that is the basic difference between an MD school and a DO school. It's the philosophy. And also, aside from what you're going to be taught, which is the course that's different, you're also going to be taught in a different way of thinking. When you see a patient, you're going to approach them as a mind, body, spirit, just as the way you would treat your family member. Now, don't get me wrong, MD schools also teach how to approach the patient's care in the same way. But the difference is, if you have an MD doctor that finds a patient that has a musculoskeletal problem, because they do not have the proper training to be able to fix this, only a DO physician will be able to apply osteopathic manipulative medicine in that scenario only to be able to fix this problem. Okay? So that is the major difference between osteopathic medicine and also allopathic. That is the other word for MDs, is known as allopathic medicine or medical school. That is the major difference. Another major difference between an osteopathic or allopathic medical school is that we all take medical exam, licensing exam. So in order to be a physician in the United States, all three of these medical schools, you have to take either the United States Medical Licensing Exam, known as the USMLE, or the COMLEX, which is the Comprehensive Osteopathic Licensing Exam. So if you go to an allopathic medical school, you can take the USMLE Step 1, Step 2, and Step 3. You got to take 3 board exams. You take this first 2 in your medical school, and this is in your residency. If you go to an osteopathic medical school, we take the COMLEX Level 1, Level 2, and Level 3 exam. This exam are exactly equivalent. They are equivalent board exams, and IMGs also have to take the United States Medical Licensing Exam, Step 1, Step 2, and Step 3, in order for all of us to get into residency. The USMLE is different from the COMLEX in some variations, because on the COMLEX, they're going to test you on these OMM skills. And these OMT skills they taught you in osteopathic medical schools compared to allopathic medical schools. And there's also some variations in the different testing questions they ask you. But you don't have to worry about that as an applicant now. When you get there, you'll be able to learn the biggest difference between USMLE and COMLEX. And I also wrote a book on the differences and how to prepare for this board exam. However, there's a catch. As an osteopathic medical applicant. You can actually apply to an allopathic medical school. Can you imagine? That's awesome, right? You can actually apply to an MD residency. But if you're going to apply, you have to take the United States Medical Licensing Exam. So you're going to take your COMLEX Level 1 and take the USMLE Step 1. You're going to also take your USMLE Step 2. It's optional. You don't have to take it. And also you have to take the USMLE, the COMLEX Level 2, which means you have to take 4 board exams, especially if you want to go into ophthalmology, ENT, like ear, nose, and throat. Those are the other, ear, nose, and throat is another different kind of surgery. You want to go to high-end specialties, and because we have more residencies. So let's talk about residency difference. DO's residencies has all the residencies pretty much, except a few high-end specialties. And the only reason why DOs have a little bit less of the residencies I'm going to talk about is because they haven't been around long enough compared to allopathic residencies. So let's take a look at a few of them. There's very top-notch specialties like dermatology. We have dermatology DO residencies. But residencies such as anesthesia, there's very, very few DO residencies in anesthesiology. So let's say you went to a DO school and wanted to do anesthesiology. You're going to take your COMLEX Level 1 and Level 2, USMLE Step 1 and Step 2. You don't really have to take Step 2, but if you do take it, it's also beneficial if you do really well on it. And then you can apply to an allopathic residency in anesthesia. PM&R. We don't have a lot of PM&R residencies in DO's residencies, so when you apply to PM&R, it's mostly going to be an allopathic residency. So those are the things you have to remember when you're applying. But residencies such as ENT, right, general surgery, family medicine, internal medicine, pediatrics, right? There's a lot of DO residencies pretty much in everything I've listed except CIS. And also, if you want to do a dermatology residency, there's dermatology residencies for DOs, but it's not as much as MD residencies. So if you want to apply to both, you can apply to to the dermatology residency DOs and also apply to the one for the MD, so you can increase your chances of matching into residency. Okay? Now let's talk about fellowships. Remember I told you internal medicine doctor can specialize in cardiology, GI, right, endocrine. When it comes to fellowships, there's not a lot, right, of fellowships. There are fellowships. We have infectious disease cardiology fellowships for DOs, but the difference is there's not a lot of fellowships in the DO world compared to the MD world. Okay, but I'm pretty sure in the nearest future this is going to increase more as time goes on. But at the time when I'm making this video, I'm just letting you know in advance that if you want to do a fellowship, and your DOs, if you end up in an allopathic residency, you might have a chance of getting into their fellowships because they just have a lot more fellowships, a lot of fellowships. For example, Hem-Onc. Hem-Onc is hematology, oncology. There's not a lot of Hem-Onc DO residencies. So if you want to do you just love cancer patients, leukemia patients, and you really want to go into Hem-Onc, you really have to go into an allopathic residency for you to actually match into this kind of fellowship, to do a fellowship in hematology and oncology. And so if you go to a DO residency and you want to do a fellowship, you just have to apply to this, and you're a very strong applicant, you're going to be able to get into these fellowships. Okay? So let's take a look at international medical graduate for a minute. If you go to an international medical school, Caribbean, now there are advantages of going to these medical schools. Let's talk about some of them. Number one, you're going to graduate with your MD degree, and it's going to cost you less money. It's going to cost less because they're cheaper. However, you're also going to be a good doctor as long as you study very, very well. You have to take the USMLE exam, just like an MD applicant. And then you have to come back to the United States to do your clinical rotations. Now, this is where the dilemma is. The disadvantage, because everything in life has advantages and disadvantages, the disadvantage of going to a Caribbean is you have to make sure whichever Caribbean medical school you're applying to actually has solid connections for clerkships, clinical rotations with hospitals in the United States, right? So you want to make sure after your first 2 years of basic medical sciences, you have somewhere to rotate, right? So you have a place to do your clinical rotations in your 3rd and 4th year of medical school. So that's very important. If the school doesn't have it, that is not a good thing, because you don't want to be hustling and looking for clinical rotations as a 3rd or 4th year international medical student. Also, when it comes to the USMLE exam, it's very important that you understand that the way the matching works, and match just means how we get into residency in the United States. The way the matching process works is it's a ranking system. So if you go to the United States, U.S. residents and U.S. citizens are favored first before international medical graduates. So it's a rank order list. Let's say you apply to an allopathic residency as an MD student in an MD school in the United States. You're going to get the first shot, right? They're going to look at your application first. They want to take their students. If you're a DO and you apply to a DO residency, right, basically you're going to get your first shot and you're going to match. Now the difference is MDs cannot apply to DO residencies, but DOs can apply to MD residency, okay? So in this case, it's going to be an allopathic graduate, osteopathic graduate, and then an international medical graduate. So you get the 3rd option on the list. And also, your USMLE scores has to be very, very stellar. You have to do really, really well. So let's say you want to do internal medicine in the United States and you're coming from the international medical schools. You have to score at least in the 85th percentile starting. Right? You want to score at least an 85 on your boards when you take this exam, because your passing score, the passing score is 75, and right now it's like 189 is the passing score. You want to make sure you get at least a 200 or 205. Let's say you're applying to an internal medicine residence in the U.S., because your score has to be stronger, if not even better, than all the applicants that are applying to these medical schools. To these medical residencies. So that might be a disadvantage, because if you don't do well on your USMLE and you don't do well on your clinical rotations, your chances of matching is very, very low. Notwithstanding, a lot of people coming from international medical graduate schools do match into residency, so don't ever get discouraged. But I'm giving you the warning shot before you go down there to say to yourself, you know what? If I don't get into medical school in the United States, I try to get into an MD school, I get into a DO school, I don't get in. I'm going to go and get my MD degree in the Caribbean. But I'm going to work hard. I'm going to work really, really, really hard, right? Study well. Do well and excel in medical school here. Get like the top-notch 99 percentile when I did my USMLE. When I do my clinical rotations, I'm going to shine. I'm going to do very well. Get strong letters of recommendation. Do research. Do whatever it takes to make me a better applicant, so when I apply for residencies, I will be able to match into the residencies of my choice. There's also a caveat. The very, very, very super competitive specialties like ENT, general surgery, dermatology, urology, ophthalmologists, those are very competitive residencies that only the top of the crop of medical school applicants actually get into. So if you wanted to get into, you're going to be an ophthalmologist, for example, you have to make sure that you're realistic, that you better be scoring in the 240s and 250s when you take your USMLE, and also understand that your chances of matching into this residency is not as the same as students applying in the US. That is just a realistic goal. So if you really want to be an ophthalmologist, I would strongly advise you to stay in the US and get your degree, because if you go down to the Caribbean, then you just decrease your chances and your likelihood. I'm not saying you can't get it. I'm not saying it's impossible, because I don't believe anything is impossible, because everything is possible. But be honest and realistic with yourself and look at the statistic. Ask the medical school that you're applying for. I want to be an ophthalmologist. How many people have actually matched into ophthalmology in your medical school? It's a fair question. And they say, hey, listen, we've got 2 people from our program that's matched into ophthalmology in the United States coming from the Caribbean. You say, you know what? Yes. As long as somebody has done it, I'm going in. Or you can also say, if nobody else has been an ophthalmologist yet or dermatologist coming from this medical school, I'm going to be the first one to do it. And then you do it. All right? But also be realistic and also plan accordingly ahead of time. That is just a caveat. That is just a caveat. Okay? So now that we've seen the differences between MD schools, DO schools, and IMGs, I have to say one more thing about what makes DO schools a little bit special, right? So, although scientific research is not as much in DO schools compared to MD schools, DO schools still have faculty members that do research, right? If you go to UMDNJ, the University of Medicine and Dentistry School of Osteopathic Medicine, we have a School of Graduate Medical Sciences which is purely dedicated to research. And one of our researchers just found, a testing for Alzheimer's disease, which is the latest research development in the finding disease pathology and processes and understanding how the disease works. So, although I did say the philosophy of an allopathic medical institution focuses on scientific research and data, and also, disease treatment and symptoms, understand that as a DO, you get to learn how to use scientific research, observations, publications, learn osteopathic manipulative medicine. You have a chance to take the USMLE if you want to go into an allopathic residency, and also the philosophy of treating the body, the mind, and the spirit is what makes an osteopathic medical doctor a well-rounded physician that understands when it's applicable to use any of these modalities, and you can do surgery and also prescribe medications. So, people might ask me, you're an emergency medicine physician, do you ever use OMT? Yes, I do. I actually use it. When my patients come into the quick check section of the emergency department and a patient is complaining of lower back pain, I treat them with OMT first. And then I write them a prescription like, all right, take this medicine and this should help. And use some ice patches and also use some rest to help the patient. Now what I've done is mechanically treat the patient, give them medications, so overall their chances of getting better is faster. Okay? And that is biggest difference. But I have to also emphasize that both MDs and DOs, right, all work together as the same healthcare team. We are one team. We work together to make our patients' life better. And that is the most important part of medicine, to be compassionate, to help your patients feel better, and to be a teacher, which means to be a doctor. And that's one of the most important aspects and tenets of medicine. So, you are the applicant. I have laid down the similarities, broken some of the myths that you've heard about MDs, DO schools, IMGs. I've given you all the options. Now you know what to do. Don't ever be discouraged when you apply to medical schools. My advice for you is have an open mind. Do your research. If you want to go to an MD school, go to an MD school. If you want to go to a DO school, go to a DO school. If you want to go to an international medical school, go to an international medical school. As long as you're going to be happy. Know your goals. What are you looking for in medicine? Why do you want to become a doctor is the most important question you have to ask yourself. If you can answer that question first, half of your work is done. And then your second step is to say, now that I know I want to be a doctor, what kind of doctor do I want to be? You've got 3 different pathways to become a physician in the United States. Now, the third thing is to do your research. Your research is to make sure what are the average MCAT scores, what are the requirements to get into this kind of school, and what are the requirements to get in this kind of school, and what are the requirements to get in this kind of school. And what do? You visit a few of these medical schools. You go through their affairs, right? You talk to them, you ask questions. And when you ask all the questions to all your answers, once you get your answers, you write it down on a piece of paper, you go to a DO school, and if you want to learn about osteopathic medicine, the only way you can learn about it is to see it yourselves. Visit your nearest osteopathic medical school and see what osteopathic manipulative medicine is all about. Now, there's another caveat. Students often say, oh, aren't DOs like chiropractors? No, absolutely not. DOs are not chiropractors. Now, some of the things chiropractors do treatment-wise might seem similar to some of the things you will learn in osteopathic manipulative medicine, but the biggest difference is to know that chiropractors only focus on the spine. That's all they treat. Now, when you go to all three medical schools, you're going to learn about biochemistry, physiology, anatomy, pharmacology, pathology. You're going to learn about biostatistics, prevention. You're going to learn about all these things, microbiology. You're going to learn about internal medicine, cardiology. They will teach you everything you need to know about medicine. In allopathic medical schools, they teach a lot of embryology, which is not taught in osteopathic medical schools. But in osteopathic medical school, we learn osteopathic manipulative medicine for the first 2 years of medical school. So that's another difference. But we all learn the same tenets, the same important core topics and subjects that an adequate medical doctor needs to understand. So you're a well-rounded physician that can treat a patient properly. So DOs are not chiropractors. Chiropractors are not DOs. DOs are licensed physicians, just like MDs, to be able to practice medicine and surgery in the United States, also just like international medical graduates that come from the Caribbean. So, on this note, do your research, do your homework. If you like the philosophy of an allopathic institution, go for it. Don't let anybody stop you, because you are the master of your own fate. You're the owner of your own destiny. Don't let anybody rewrite your own history. If you attend a DO school and you visit there and you see, I like this philosophy. I want to be a primary care doctor. For example, let's take a look. I have to give you one more statistic. So, if you visit a DO school, it's very important to note that out of 100% of DO physicians in the United States, 60% of doctors that graduate from osteopathic medical school go into primary care. And 40% go into specialties. When I say primary care, family medicine, pediatrics, and internal medicine. So, you have to understand, if you really want to be a family doctor, and you love the tenets, and you want to learn about osteopathic medicine, and you want to learn about how to treat the body, the mind, and the soul, and the spirit all together in one, and you love, the philosophy and the concepts of osteopathic medicine, you should definitely apply, because then you'll be able to get into any of these specialties, because most family doctors are coming from osteopathic school, comprised of almost 60%. Okay? But remember, you can become anything, any kind of doctor you want to be, and that's the other 40% that I listed at the beginning of our lecture today. And when you go to an IMG medical school, International Medical Graduate School, in the overseas, remember that you just have to go through the pathway to take your USMLE Step 1, Step 2, and Step 3, pass your CS when you come back to the US, and you want to do very, very well on this, so you're also competitive to be able to get into an allopathic residency. Remember, as an IMG, you cannot apply to a DO residency. You can only apply to an allopathic residency. So I hope I've been able to convince you, to give you options, to be able to know and have a little more knowledge about how to approach medical school. Well, I am the founder of Future Teaching Physician Lectures, known as ftplectures.com, where I teach nursing students, medical students, physician assistants and help them succeed to do well when they take their exams. And as I teach internal medicine concepts. And it's very important that you know that someday you're going to actually come back and watch some of my videos to be able to understand some of the clinical concept that's going to be taught to you in your medical schools. And I'm going to be there to be able to oversimplify these lectures for you. So always remember, subscribe to my channel, click the like button, and also subscribe to my channel up here so that I can keep making these more videos for educational purposes for all the applicants out there coming today and in the future generation. Because you know what? You are going to be a physician. You're going to be the best doctor you possibly want to be. And don't ever let anybody rewrite your own history. Don't let anybody tell you you can't do it. Remember, my people perish because of lack of knowledge. And now I have given you the knowledge. I have shown you the way. It's your choice to pick your own path. Pick it and be the best doctor you can ever be. Thank you very much for watching this video. It's Dr. Adeshina again from ftplectures.com. Please like my video and also subscribe to my channel. Thank you very much for watching.